Well, Lisa, as you know, the month of June is Men's Health Month. News 8, along with Griffin Health, are trying to improve their health, of course. Sleep apnea is our topic today. Joining us in studio is Dr. Mariah Chasen, pulmonologist and Sleep Wellness Center Director. Peter Forcelli is also here, Director of Respiratory Services. Thank you very much for joining us today.
Thank you for having us.
All right, Dr. Chasen, we're going to start out with you. Just tell us exactly what is sleep apnea.
So sleep apnea is characterized by repeated episodes of either partial or complete collapse of the airway. And as a result of that, you have cessation of airflow. And because of that, we're not able to get in the oxygen that we need. That triggers a series of physiologic reactions, and it makes people go from deep quality sleep to twilight sleep. So in the morning, they don't feel refreshed, they feel tired, and they don't feel like they had a good night's sleep that they need.
All right, of course, we've been hearing a lot about sleep apnea, but what are some of the signs and symptoms of it?
So signs and symptoms are loud snoring, your bed partner saying that you actually stop breathing at night, morning headaches, frequent nocturnal voiding events, and then it's associated with other things like high blood pressure, cardiovascular issues such as heart problems, arrhythmias, etc. So anybody that has snoring, witness apneas, and daytime fatigue, you should be suspicious of it.
All right, of course, Peter, as you know, we're talking about men's health. So how important is sleep to men's health?
Yeah, sleep is it is foundational. And by foundational, I mean it supports heart health, hormone balance, mental sharpness, even testosterone production. We know that poor sleep leads to a whole myriad of issues like weight gain, depression, a higher risk for heart disease, diabetes. These are all conditions that are more common in men as they age.
And so do we find this more in men or women? And if it's in men more, why is that?
Yeah, absolutely. And when we talk about sleep apnea, 1 in 4 men in the United States has some degree of sleep apnea. 80% of those cases are undiagnosed. The reason is, men typically have larger neck circumferences, which puts more weight on the airway, so they are more at risk for sleep apnea. Men are also more likely to downplay or ignore their symptoms, right? Like loud snoring or daytime sleepiness, mood changes, and just kind of chalk it up to the stresses of day-to-day life when there really may be a serious medical condition.
That's us men, ignoring those signs and symptoms. All right, Dr. Chasen, let's save some marriages right now. How we can go about treating this problem? Because a lot of women are complaining about this.
They do, in fact. So the most common way that we treat sleep apnea is with what we call CPAP, which is continuous positive airway pressure. And people always think about the mask when we talk about CPAP, and there's a lot of different ways that we can apply, positive pressure to a patient. But, ideally for every patient, there's a different solution. So the best recommendation I could give is to talk to your provider about it, and we can sort of customize treatment for every single patient.
All right. Peter, talk about the respiratory center there, your director. Kind of tell us exactly what goes on there.
Yeah, well, especially with the Sleep Wellness Center, we have trained patient navigators that can walk you through the entire process of being evaluated, to tested, to treated for sleep apnea. We know that sleep medicine is very complex, and some people just don't know where to start. But if you're having those symptoms, don't ignore them. Give us a call, reach out to us, and we can guide you through every step of that process.
All right, definitely good news. And of course, today is Juneteenth. When it comes to sleep apnea, is this something that affects African Americans more, or where do we fall in the spectrum there?
Actually, the prevalence of obstructive sleep apnea is higher in African Americans compared to whites, and we know that it does go underdiagnosed, and we also know that the outcomes can be worse. So if anybody is experiencing symptoms, they really have to reach out because of that reason.
All right, thank you very much, Dr. Chasen and Peter Forcelli. Very good information here, and like I said, we probably saved some marriages today. Well, and you can also head to our website, WTNH.com, for a link for information about sleep apnea.
June is Men's Health Month, a time to take proactive steps toward a healthier life. A reminder from the Griffin Health Initiative for Men and the generosity of Frank and Judy Michaud through the Valley Community Foundation.